So another one important thing is the tumor markers. So these tumor markers are very, very important while assessing the patients and regarding the cancer. So these are going to be the prostate specific antigens. So the special test to exactly know about the like a cancer cells. So these are going to be the tumor specific, that is a prostate specific antigen is going to be always present in the low concentration in the blood of adult male. So, but this is going to be the normal. But if it is elevated, this prostate, like the specific antigen, if it is elevated, it indicates in the prostate cancers. So who are having the highest high level of the prostate specific antigen means, so it is indicating the like a prostate cancer, or maybe is conditions of benign prostatic hyperplasia. So it's most commonly seen in the who are having the cancers. So these levels are used to evaluate the how a patient has responded to treatment and check for the tumor recurrence. So not only for the assessment and also during the treatment of the prostate cancer, also we have to check the prostate specific antigen, because we have to know the how the progression with the treatment, with the medications, and also other treatment plans. So how the improvement in the this level of the prostate specific antigen. So coming to the prostatic acid phosphate. So this is also going to be is normally present in the small amount in the blood, but in case of prostate cancer, it also going to be increased. So prostate cancer, testicular cancer, leukemia, and also Hodgkin's, non-Hodgkin's lymphoma, as well as the non-cancerous conditions. So small amount is available in the blood, but who are in high levels of this prostatic acid phosphate, it indicates the prostate cancer. So easily, if any patient complaining about the bleeding and also severe pain in the like a prostate regions, abdominal pain, and also in the penis levels, or maybe in case of the like a ureter level, so we can check about these two marker tests, so we can diagnose who are having the prostate cancer or any testicular cancers, so we can easily understand according to these test markers. And also next one is a CA 125 like a test markers. So this is going to be the ovarian cancer is most common cause of the elevated CA 125. So, and this is the most common in case of in female who are having the ovarian cancers. So we can found this, this is going to be elevated. But cancers of the uterus, cervix, pancreas, liver, colon, breast, lung also, and also digestive tract also can rise in this cancer levels of the CA125. So that is the reasons. So if we give this special test, so we can analyze what the different type of structure involved, we can easily understand. The several non-cancerous conditions can also elevate these CA125 is mainly used to monitor the treatment of the ovarian cancers. So sometimes we have to differentially diagnosis. So it may chance to get the non-cancerous cells also may increasing the cells. So we have to see the physical examinations, clinical symptomology, diagnostic procedures, along with these tumor markers. So all we have to differentially diagnose this, so we can confirm the tumors like a diagnosis. And also next, another one is the carcinoembryonic antigens. So this one is going to be found in the small amount in the blood, but in case of colorectal cancer, so this is going to be increased, and also this embryonic antigen is going to be increased in case of the colorectal cancers. So several other cancers also raise the carcinoembryonic antigen is going to be increased. So these are the special tests to identify this cancer like a markers. And also alpha fetoprotein also going to be normally present in the pregnant, so who is in the fetus, but is going to be increased in case of who are having the liver cancer and also ovarian cancer and also testicular cancers. Next one is the human is a chorionic gonadotropin hormones, is a HCG hormone. So these also normally appears in the pregnancy, is produced by the placenta. So because of this thing only, we are going to identify the pregnancy is positive or negative through the test. We are going to identify with this special test. But in case other than this pregnancy, if this antigen is increased, so this marker is increased. So in those conditions, if anybody having increase in the HCG levels, so it indicates the testis, ovaries, and livers and stomach cancer, and also lung also. So in case of one more thing is a marijuana, or nothing but is the opium or ganja also one of the causative factors, or may raise the this HCG levels. So if you know all the information, we can easily differentially diagnose it. So we can diagnose and also cancers. So what type of cancers according to this tumor markers. And also this other marker CA, the 19.9. So this also going to be or having the colon and stomach cancers. So these levels are going to be increased. And also in case of the pancreatitis or gallstones also, these levels are going to be increased. And CA 15.3 also. So these also going to be used to course of the treatment with advanced breast cancers. So these also going to be increased, or who are having the colon, stomach, kidney also going to be increased. And also CA 27-29. So these markers are used to follow the advanced breast cancers. So in the treatment of breast cancer, so we are going to check the CA 27-29 cancer. Tumor markers are also helpful to identify the colon, stomach, and kidney and lung and ovary, pancreas, uterus, and liver cancers. As a bladder tumor marker studies, so these are going to be the characteristics of the markers are substance released by the bladder cancer cells in the urine. So these markers, so if any like a blood or any abnormal cells in the urine also, we are going to be identified with the bladder tumor marker studies. So we can easily understand what is the type of the cancer, we can easily understand. So these tumor markers are very important to diagnose what type of the tumors. And also another tumor marker is the lactate dehydration. So this lactate dehydration is a protein, is normally appears throughout the body in a small amount. But in many cancers, so is going to be this lactate dehydration is going to be increased. So, it is not useful in identifying the specific kind of the cancers, but measuring the LDH can be helpful monitoring the treatment for the cancers. So that means while giving the treatment, so how they are going to be respond, so how the levels are of the lactate dehydration is, so it will helpful in during the treatment of the cancers. So non-cancerous conditions that can raise the LDH. So also including the heart failure, hypothyroidism, anemia, lungs or liver disease also sometimes. So this lactate dehydration is going to be increased. And also non-specific and also the neuron specific is an analysis. So these are going to be associated with the several cancers, but is used most often to monitor the treatment patients with the neuroblastoma or the small cell lung cancers. So these are going to be, so these are tumor markers are going to be useful to identify the different type of the cancers, where the tumors are got the cancers, especially which organ is going to be affected. So with the tumor markers, we are going to identify what type of the tumors. So that's all about these are the tumor markers. So until now, we discuss about what are the different types of the characteristic features of the tumors, and also symptoms, what are the major symptoms in the men and women, and also what are the common symptoms in the men and what are the other common symptoms in the women. And also next one is what are the stages in the tumors, different type of the stages, how we are going to differentiate which one is like a severe stage and also less stage. And also is a blood test and also urine analysis and tumor markers. So until now, we discussed about the diagnosis of the tumors and cancer cells with the tumor markers and also blood test and also urine analysis. So in the next topic, we are going to discuss about how is going to be the diagnostic with the imaging technology and also special techniques. So how we are going to discuss in the next class. Hope you understand clearly until now. If you have any doubts, you can message me. I can clearly explain and also. So see you in the next class. Thank you very much.